South African Military Health Service is being tasked to erect the level 2 facility, which is one of the components that we are having as South African Military Health Service.
This is level 2 and it's fully equipped. We talk from a point of a research station to a laboratory. So basically this is a fully equipped level 2.
We have prepared theatre for minor surgeries when we get the anesthetist and the surgeons. We have all the equipments in theatre like the Bell's machine, anesthetic machine to put the patient to sleep, the pulse oximeter and the monitoring for pulse, blood pressure, saturation, everything. We have everything in order. It's only the patient. If we have the patient, we should have anesthetist and the surgeon.
After the announcement by our Commander-in-Chief that is a national lockdown, for me it meant that now we will really start working with everybody, not only the Defence Force members, because the lockdown has affected everybody health-wise and on their personal capacity.
Currently, we are deploying the facility here in preparation for the overflow of patients from one military hospital. The facility currently, as is pitched, as you can see it at the back, is having different components, including the triage, whereby we are going to sift our patient. We have the screening facility where we are just going to screen our patient and see whether we can refer them. We are also having the theater whereby we will only deal with the minor surgeries because of the kind of facility we are having. We are having the high care unit whereby we will be admitting patients that are only in need of high care, meaning will be that patient will be maybe needing the oxygen facility, so we'll be needing such kind of a patient in this facility.
With that being said, I knew exactly that in any case, it could be any disaster or any form of, what do you call it, any form of disaster, so to say, will be called in to come and assist. So I'm very proud of what I'm doing, and I'm looking forward to seeing that South Africans, all citizens in South Africa, they can look up to us that we've got things under control.
Serving the South African National Defence Force, it meant that you put the people of the country first before yourself. And then in these cases, we are fighting the enemy that we cannot see. You can meet it anywhere, anytime. So it meant I need to sacrifice myself in order for the next person to be well.
COVID-19 is here. It's not going anywhere anytime soon. Our responsibility as the nation is to take precautions. We must abide to the rules of lockdown. We must stay at home. We must wash our hands. Soap and clean water is enough for 20 seconds. And then we have to maintain the social distance in order to try by all means to flatten the curve.
To the South African, I'll pledge with them, please stay indoors, stay in food, wash your hands, look after your kids, most importantly, because they are the one with the low immune system. Look after the elderly. Make sure that your kids don't run around.
obey by the regulations, as it was stated by the president that they have to basically stay indoors because this pandemic is causing chaos throughout the world. So with me being called, I can assure them that the Defence Force members are out there risking their lives to ensure that there is no spread of this virus throughout the country.
By them staying at home, they're also saving us. Because if all of us can stay at home, at least we're gonna reduce the number of people who are gonna be infected.
I can say to all those that are adhering to the lockdown rules, you are doing the right thing. You are protecting yourself and your family from the virus.
They must keep up the standard. As the Minister of Health, Zweli, has said that they must continue doing what they are doing, like sanitizing their hands and washing their hands, and then keep, as they have been instructed. We thank them for being indoors all the times.
And it also shows us that they get to understand the message that we are bringing to them. As much as the government has proposed for them to start staying at home and us rendering care to those who are already infected, them staying at home shows that they understand the importance and the seriousness of this condition. So we appreciate their understanding and efforts, and we wish that their neighbors and close families could take example from what they do for us to get to combat this virus.
Let's go towards flattening the curve. Actually, our main thing is to flatten the curve, not to raise the curve. So, by adhering to what the President and the Minister of Health is saying, we are going to flatten the curve so that we can be able to manage those who are infected and get a virus-free country.